Okay, I'm going to get started. We've got a fair few number of people in the room. So just to reiterate, thank you for joining us this morning for our nursing, midwifery and kind of healthcare subjects webinar for college advisors and subject tutors as well. So yeah, really great to have so many people in the room, and also to have our fantastic panelists. So my name's Jess, and I'll be your host for this morning. I'm not really sure if that's an overly cheesy line to use, but it's how I always feel when I introduce these events. So I am sort of one part of the Outreach Hub team at Linking London, and we work under the Uni Connect programme. Obviously, some of you will have been to our events before and be fairly familiar with my dulcet tones. So sorry about that. Before we get into kind of the sort of the nitty gritty of the event, we'll have to do the sort of boring housekeeping stuff first. And I know that some of you are probably really familiar with Teams. Maybe some of you are more kind of familiar with Zoom. So just kind of outlining what sort of the different buttons do for this event. So you should have access to the meeting chat, and you should be able to kind of put any questions or introductions in there. If you don't, then please do feel free to kind of email Melanie, my lovely colleague, with any questions for the event. Because I know that sometimes people have access to chat and some people don't, depending on what version of Teams you're using. So I know that can be a bit difficult sometimes. If you could remain sort of muted for the duration of the event, that would be great, just so that we don't get any kind of feedback or anything like that. And you may find it helpful to have your video off, just to kind of support with kind of bandwidth issues. During the Q&A portion of this event, you are welcome to kind of raise your hand and then unmute yourself to ask a question. If you prefer to just put it in the chat, that's absolutely fine as well. It's completely up to you, but do bear in mind, because this meeting is being recorded, if you raise your hand and speak and have your camera on, that will be kind of picked up by the recording. So you may just prefer to have it in the chat. Let me just check that. So everything that I needed to say. Cool. So on to the agenda. So obviously we're just doing a little introduction now, and then we'll get into the discussion with our panels. So what we're going to do is we're going to have our lovely panelists. Let me just mute everyone to make sure that we're not getting any background noise. So we'll have our sort of 10 minutes for each panelist to kind of introduce themselves and sort of outline, sort of some of the things that they would like to cover today. Some comments on kind of where we are in the sort of the admission cycle and kind of how they've experienced things, particularly over the last year, and hopefully some kind of advice for attendees advising applicants as well to kind of nursing, midwifery and healthcare courses. So our panelists are Jane from Kingston St George's, Caroline from Middlesex, Fiona from LSBU and Beverly from UEL. I would just like to say that I'm really excited to kind of hear what they're going to say during their kind of introductions, and as well for the Q&A. I think it will be really beneficial for everyone to kind of hear their contributions. So I hope you're kind of as excited as I am, essentially, to hear from them, and I hope you find it really useful as well. I think we've got a lot of experience amongst the panelists, which you'll all find really helpful. So without kind of further ado, essentially, to try and prevent me from waffling on, what I'd like to do is hand over to Jane Foreman to kind of kick us off for just her introduction to her institution. Jane, you're unmuted, so take it away.
Hi, thanks, Jess. My name's Jane. I'm a midwifery tutor. I was a nurse for about 8 years, quite a long time ago when I was young. And I've been in education for about 9 years, working at a couple of different universities. I think that I'm sure the other my colleagues are going to say as well, it's been a highly competitive year this year and last year, because of COVID, and we've had a really big rise in our numbers of people applying for our course. But nevertheless, we like some of my other colleagues are a widening participation university, which means we kind of try and look beyond the, if you like, educational privilege or cultural privilege of the people applying and see what they're actually like. And for that reason, I do read the personal statements of everyone that my admissions team turns down, and we do try and have some flexibility around around personal statements and work experience and grades in some years, although last year and this year it's looking like we are not going to be able to be so flexible because we're so oversubscribed. I mean, I don't know if we've got any students here today. I think, is it mainly career people, Jess? Yeah.
Yes, yeah.
But I'm happy, and so I'm in a school with paramedic science, physiotherapy, radiography, and occupational therapy, and we're really happy to we support each other with events, and we're happy to go into schools together virtually at the moment, and in real life when that happens, and talk about the different professions. We're more motivated, I would say, by encouraging people that wouldn't have normally considered working in the NHS to think about health professions rather than our particular university. Obviously, I think my university is brilliant or I wouldn't work there. And I've got a really lovely supportive team, very student focused. Some universities can be a bit process driven, but our university definitely isn't. If it's right for a student to qualify and be a midwife, then we will get them through it. It's not right for everyone, but the vast majority of our students, we do get them through it. But and that's really important to us and all my colleagues as well. We've also got a large nursing department in our university, but we're not in a school with them, but we do join up and do some stuff together as well sometimes. And what we're looking for, well, as we take less notice of the personal statement really, because it's kind of a bit college and school dependent what sort of personal statement you get. So we look at more things like sort of how they perform in the interviews really, and what their academic profile looks like. So we do values-based recruitment, which I think everybody probably should be or would be doing nowadays, which in our case, we present ethical scenarios with no right or wrong answer and ask our candidates to explore what their decisions would be. And they're all based around NHS core values. So like communication and empathy and integrity and things like that. We did them online this year, and it's likely, so St George's, where the rest of my school is at, are going to switch to online in September, but it's likely that switch to real life in September, but it's likely that we're going to continue doing it online because we're a very small school. We do it collaborative with our clinical partners, and our clinical partners have had a terrible year basically, so it's going to be easier, I think, to carry on doing it online. And that seems to be what some of our candidates prefer, because from a widening partition, it swings and roundabouts, isn't it? Because it means they don't have to pay to travel to come and see us, but also they don't then get to see the university and meet our students. But also that some of our students this year and last year have had real trouble with Wi-Fi connections, finding somewhere private. I've interviewed quite a few people in their cars, because I think to get away from their children basically. So it's about balancing it to make sure it's fair for everyone really, but we will be doing that in collaboration with our partners and our local colleges as well, what they think their candidates want. So I'm really happy to answer any questions. I'm also really happy to support students, especially students that haven't got much cultural capital, with a application to midwifery. So I'm really happy for my details to be passed on. And we are, as a school, we're all really happy to come along and talk to your candidates about different NHS careers. Most of us signed up for Health Education England's sort of ambassador scheme as well, and go out to the bigger fairs and things. So I think that's me. I think that's probably enough, isn't it, Jess?
Yeah, that's great. No, I think that's a really, really great introduction, Jane. Thank you. Yeah, absolutely. So I'll hand over to Caroline Sargiston now from Middlesex University. Yeah, so go for it, Caroline.
Hi, I'm Caroline. I work at Middlesex University. I'm an adult nurse, but after years of programme leadership, I then took on the role of recruitment, and I cover nursing, midwifery and social work. And like Jane, we've had a busy year. Our applications overall have been up 19%. And at the moment, our offers are up 17%. So all our programmes are closed apart from adult nursing. So we won't be going into clearing this year with any of our nursing midwifery programmes. It's been interesting. We do face-to-face interviews, again, values-based, but the old-fashioned interview format where we just ask them questions. And again, same issues. It's been online, which I think the students have appreciated, but we would like to see our students coming back to the university and having the university experience. But for some students it's been easier, but others, we've seen the Wi-Fi poverty, the lack of appliances, the lack of space, privacy, good Wi-Fi, and I think some students have been challenged by this. So for some people, we've asked them back if they've been challenged by their interview. We haven't made any decisions about what we're going to be doing next year at the moment, because we're still weighing up, the pros and cons. And like with the online teaching, some of the students have reported they've quite liked having the online sessions because of issues around childcare and travel. So again, these are all the things that are currently being reviewed. One of the issues I'd quite like to discuss, and we've already had a bit of a chat about this, is the amount of people, sadly, we've had to reject because they just don't, or they're not able to articulate the role of the nurse or the midwife. So lots of talk about being kind and caring, which is lovely, but the unsuccessful candidates, I would suggest, don't have the insight into the professional responsibilities, the critical decision making, leadership, management. And I think we need to be looking much more at that. Particularly, I found this year, because I've covered the majority of the interviews, as most of my colleagues seem to be vaccinating. The child applicants I felt were particularly weak this year. There were lots of them who thought that being kind and caring and working with young children was what nursing was about. And I suspect my colleagues have found the same. I'm not sure, is Natalie here?
Yeah.
Natalie, do you want to say anything about some of the work we've got planned?
Yeah, good morning everyone. I'm Natalie. I work in the Education Liaison team at Middlesex University, and I really support students trying to get into nursing and midwifery. And we've got some great work planned with Caroline and Caroline's colleagues around. We're just about to embark on a project called Get Into University Week that's taking place at the end of June, where we will try to support especially the nursing students with their personal statements, with how to apply, and also working on preparing for interview really. And then in the long term, like Caroline has just said, we really want to ensure that they know what a nurse or a midwife does. So again, we're going to be working together, bringing together some careers panels with people that are like nurses that are working in the hospitals at the moment, or in the so that the students can get to understand what these guys actually do, and really is it for them as a career option. So really we just want to ensure that we're empowering them to be able to make the right decision, and that's where we're at right now. Is that okay, Caroline?
Yeah, that's fine, thank you.
Yeah, that's great. Thank you.
That's us.
Yeah, okay, fantastic, great. Thanks so much, guys. Really good to hear from you guys. So what I'll do is I'll hand over to Beverly now from UEL to chat a little bit about kind of her institution and her situation.
Well, hello everyone and good morning. Thank you for inviting me onto this. I'm Dr. Beverly Joshua. I'm Head of Nursing for the University of East London, and it's an absolute delight to meet you on this virtual platform. The University of East London, we're a civic-led university and we're very career focused. It's been in existence since about 1898, where we've been pioneering lives and with a strong focus of changing the health and educational inequalities in the East End of London. Our focus is on creating opportunities for those learners who would not traditionally have been able to get or meet the criteria to get into higher education. We direct our focus on developing professional and a student's professional fitness and their mental well-being, with key areas on intelligence, their individual intelligence, their emotional intelligence, cognitive learning, as well as developing your digital proficiency so that you are competent in this very dominant technological world that we now find ourselves in. As you may know, we are situated in Stratford. It's a buzzing metropolis of sorts. It's very close to the much known and widely publicised Westfields shopping centre. And there's direct links from London with 20 minutes away from, and a 20 minutes journey via the Jubilee line to London Bridge. We are also a multi-sited university. So we have campuses in Stratford, where nursing is predominant, as well as Docklands, where we have nursing belongs to the School of Health, Sport and Bioscience. So there's large bioscience departments and sports departments on the Docklands campus. So we would ask you, why do you want to choose a career in nursing? And lessons from this pandemic really strengthen how valuable and what a meaningful contribution nurses make to society. We would ask you to question the experiences that you've had, and because no 2 days would be the same, and the rewards that you get from being a nurse. And myself, I'm an adult nurse. I specialize in intensive care therapy. So you look at what a difference you make to patients when they're most vulnerable. In addition to that, there's the flexible working, having exposure to multiple specialities. And we would ask you, why would you choose UEL? Well, we have a really supportive, highly qualified staff, team of staff. Many of whom have still very strong links in the community, as well as in clinical practice. We are also very dedicated in supporting student success through our Centre of Student Success, which helps you identify those inefficiencies in your learning, and thereby enables you to develop those learning strategies to overcome the barriers to learning in higher education. Now, there's several routes into nursing that we have. I'm just looking for this present. Yes, several routes. We have a focus on the BSc adult nursing, and we're also followed by the foundation science in nursing associates. Within those groups as well, I think I'll be sharing the entry criteria that you would need to get into what's covered on the courses, the entry criteria to get into nursing. And looking beyond that, we're going to look at the nursing associate programs and what's needed for that as well. With our course provision, you would be working with highly world-recognized trusts in our local area. We are affiliated to these trusts, and you will have those clinical experience with different types of patients. We've also extended beyond the NHS trusts into community practice, into primary health care, as well as into the independent sector as well. So students have a varied experience as they go through these various clinical exposures. We move on to the foundation nursing program. Within that, we have two routes. We have a route for an apprentice nurse that may come directly from a clinical partner, or a direct route, or a self-funding route. Now, there's a little play on words there. It's not that you self-fund, it's an application that you put through Ucas to get into the program. If we move on to that, so the Ucas application process, I think you're all very aware how to get through on that. And like my colleagues on the panel, it is those candidates or applicants that we have shortlisted will then go through a values-based interview where there's a focus on your experience or what your view of what nursing is about, or how in-depth you know about nursing, and how it is just beyond just being kind and patient with clients, etc. It's about your somewhat more knowledge about what nursing and what value you bring into the nursing practice. Our applications are still open for September 2021, especially with our Foundation Nursing Associate program. And with the various routes, we also have a 4-year BSc Honours Apprentice route. We have a 2-year top-up degree route for nurses, and we have the 2 programs running with the Nursing Associate provision. On the slide, You may see the program leads that you may contact directly, who you could have a chat with and find out more about the program and the course. And our admissions tutor, who unfortunately is not here today, is Mr. Shabi Kathala, and I'm leaving you with his email address as well. So we look forward to hearing from you, and I look forward to speaking to you more in the question and answer session. I'm also here with Lauren, our external director from our External Relations Directorate. So Lauren, is there anything you'd like to add?
Hello everyone. Thank you very much, Beverly. Just to say that we're running sort of a series of events very similar to our colleagues at other institutions around how to write a strong personal statement. So we're actually delivering one of those this afternoon. If colleagues do want to join us, but I would thoroughly recommend you sort of encouraging your students to attend those as well. We've got another one taking place on the 15th of June. Sorry, at 4:15. So those are webinars.
That's great. Thank you both, Lauren and Beverly, for that. And just to kind of emphasise, we will be sharing kind of slides and obviously the recording after this event, and we'll make sure that any kind of relevant events that kind of colleagues have mentioned during the panel discussion, we'll make sure that those are kind of included in the follow-up email, so you kind of got everything all together. So now to hand over to Fiona, our last panelist, for her introduction. Cheers. Thanks, Fiona.
Thank you, Jess. My name's Fiona and I work at London South Bank University. My colleague Rose is with us today in the audience, and I'm sure will be joining us in the discussion. So I'm hoping that you can see my presentation.
Yeah, we can see that fine. Thank you, Fiona.
You. So I want to, as I'm introducing myself and promoting London South Bank University, focus on how applicants can really add value to their application. I am the admissions tutor for children's nursing, but I also coordinate for the other nursing fields. So we have adult nursing, mental health, learning disabilities, and I do work closely with the admissions tutor for the allied health professions, so I can field any questions there too. I want to make really clear that an application to health studies is a professional application. So for the nursing, it will be with the Nursing Midwifery Council, and our students on qualifying will be registering with that body. And they do oversee our courses, they monitor the courses. We do work very, very closely with them. So it's not just an academic award. We do have bachelor's, postgraduate diploma and masters in nursing. It is this registration with the NMC. So I would strongly recommend that any of your students do look on the NMC website. There's lots of information there about the standards that they're expected to reach. Now, applicants do, of course, need to be intelligent and get their Ucas points. Everything, of course, is easily available on Ucas and on the university's websites advising. But they need to be highly motivated, emotionally intelligent, empathetic, observant, numerate, literate and IT literate. And they also need to be physically and mentally strong. There, of course, we are compliant, of course, with the Disability Act, and we have had applicants where reasonable adjustments would not be sufficient for them to complete at the end of the course. When they're registering, our students do, of course, need to be independent practitioners. And what we will do, if people advise us that they have a disability, we will interview them individually. And if they, when we explain what is required, realise that this course is going to be too demanding for them, then we are obliged to advise them on other courses within the university. It's quite a challenging process, and I have involved further education teachers, lecturers with that. so that we can arrive at a good position for the student. It is very demanding. Nursing does require a lot of physical work and also mental strength. We heard Caroline talking about her children's nursing applicants, and we also find that there is a degree of naivety amongst quite a number of children's nursing applicants. And at open days, I will always show this picture just to reinforce that children's nursing is a lot about very, very, very sick children and their families. So when you're speaking to your students who are interested in coming into this profession, please do stress this. They will require a lot of emotional resilience if they are going to be able to be registered nurses. As my colleagues have pointed out, it's value-based recruitment. There is a very nice quiz on the NHS Constitution website that your students could actually undertake to test their values. The values, of course, are those of the NHS Constitution that we use within our interviews, and also the university's values. Essentially, the students, the applicants, will need an ability to cope effectively in an emotive situation. And sometimes the questions within the interviews will actually test them on this. They will face death and very, very difficult situations. And they need to be able to cope. Clearly, the interview will put them through an emotional situation in itself, a challenge of an interview, and they need to be able to cope with that, continue to speak if things become emotional, and if they can't gather themselves, then they won't pass the interview. I would strongly advise that you give them practice interviews wherever you can. They need an understanding of diversity related to gender, race, culture, religion, sexual orientation and disability. And within our questions in the interview, there will be stories associated with these characteristics, and we will be looking for an appropriate response. Of course, essentially, they need the ability to communicate effectively, and we have too many applicants who fail to communicate effectively within the interview. Some of them can hardly speak. Others cannot speak articulately enough. So practice is really important. They need to know what nursing is. And in terms of the other allied health professionals, they need to know what that profession is about. And it is probably the most common reason for rejecting at interview is this inability to be able to articulate an understanding of the profession. Strongly advise that you get your students to research, and they can go onto the Royal College of Nursing website or the Nursing Midwifery Council website for a lot more information. At the point of application, the common reasons for rejection are an incomplete application form, failure to meet the entry requirements, which is very disappointing that applicants haven't actually read what they should have either on the Ucas website or on the university website. They will occasionally miss recording their educational qualifications. We do want to see South Bank that they have 5 GCSEs, A to C, or 4 to 9, including English and maths. We want students with a broad education, so that's why we do value GCSEs. They also will have a reject if it's an inadequate personal statement. As a widening participation university, our demands of that personal statement are not too much. An expression of their suitability for whichever nursing course they are applying for, and for it to be written in decent English. Of course, writing the personal statement, there's plenty of time, it's not time limited, and they can check it out, they can do their checks, they can get somebody to read it. So we do expect that. We also appreciate that a personal statement is not particularly a good thing that, you know, that we can judge really. We appreciate, like Caroline said, schools and colleges will give a lot of support with that. So we don't hold too much with the personal statement, but we do expect it to be written well. The most common reason for reject following the interview is this inability to express an understanding of the role of the nurse, and particularly within the scenarios, we realise that applicants that fail the interview are unable to express an understanding for the need for empathy, this inability to see things from another person's perspective. And the little stories in the scenario will demand that they do look at the characters' positions. The most common reasons for not completing the programme, well, it's multiple reasons, a layering of reasons. So it might be that the landlord throws them out, then their granny dies, and then it's a long way to their placement area, and then the academic failure begins. And it's really sad that students don't actually ask for help. So that's something else I would ask you to ask your students is, you know, please ask for help early so we can do something about it. We always have a drop-off after the first placement on a ward when students realise that this is unrealistic, they got it all wrong and they don't really want to do this. And then later on we do have issues with shift work and childcare and travel. And sometimes homesickness, although recently our students are predominantly from the London area. A few years ago we did have students from all over the UK, and I'd always watch out for the student that where their home was in Cornwall, they would invariably be somewhat homesick. So there's lots to challenge your students with and sort of question them about, you know, are you really ready for this? So the applicant needs to consider living in London, travelling to placement. It's very demanding. They need to think of the care of any dependents that they've got and any family responsibilities, how they're going to manage financially, how they're going to manage the bursary is not very much, but thankfully there is one now, and how they're going to manage accommodation. Because these all mount up, and when things start to go wrong, that's when they will begin to fail on the course. So the timing, the course and the university needs to be right. I think advising your students on the university, it might have to simply be down to location, one that's around the corner from where they live because they feel that they can't afford to live independently. You know, at the end of all of this, you know, it's not a good advert actually for London South Bank, is it? But I want your students to join the nursing profession and to register. And if going to a different university is the way to succeed, then that's what I would promote. So choose the right university, choose the right time, wait a year with, you know, if the student's got small children, it might be better just waiting. Choose the right course. So I wish them all the very best in their applications, and of course they can look at our websites, they can contact us and myself and Rose, who is in the audience, and hopefully their application will be successful. Thank you.
Fantastic. Thank you so much, Fiona, for such just a great kind of overview of the challenges and what they need to kind of consider. Oh gosh, just saw my face very large there. It was very very alarming for you all, I'm sure. So what we'll do now, actually, I think if it's okay with everyone, if you kind of put in the chat whether you think yeah, okay, yeah, comfort break, or if you just want to power on through, then we can move into the Q&A. But what I would just like to ask all the panelists a question on the kind of the GCSE requirements. So we had a question in the chat about obviously there's a GCSE English requirement, so could people kind of say whether that's English literature or English language? Either would do. So Fiona says kind of English language for LSBU, and so yeah, no, there you go. Raise your hand, go for it, Fiona. Go ahead.
Yes, we expect GCSE English language level 4 or above. or functional skills. So LSBU will accept functional skills, and if an applicant has been educated abroad, then we will expect an IELTS, so International English Language Testing, with a score of 7. So for nursing, it's actually higher than the other courses within the university.
Great, thank you, Fiona. And Caroline, yeah, go for it.
One of the things that we have implemented this year is if we've got students, it came in last year because of all the issues around the level 2 qualifications, is that we would look at evidence of their ability. So if someone had done a degree, say in a different subject, we would look at the fact they'd done a dissertation as evidence of their level 2 written English and understanding of English. So we've tried to be more imaginative of looking at qualifications, because it seemed, you know, students were struggling to get their level 2 qualifications last year. So we tried to look at them overall when considering qualifications.
Great. And guys, Jane and Beverly absolutely do input. We've got a couple of questions popping up in the chat about students sort of currently resitting English, GCSE and maths, and whether they would be kind of considered for midwifery and nursing courses. I don't know if Jane, perhaps you would like to take that question about kind of resits and also speak about the English requirements as well. Jane, you're on mute, sorry.
We would consider anyone that was retaking maths and English. We wouldn't look back or only look forwards. Our requirements are English, maths and science, GCSE or equivalent. So we will also take functional skills, but for midwifery, we require a science or equivalent GCSE. So some of the health and social care we will take as the equivalent, but not all the BTECs are the equivalent. And lots of students think they are, but they're not for us. So yeah. I mean, we're quite aware that I had a few candidates last year, unfortunately, who had signed up to do maths online. So when it was all suspended, they couldn't even get a predicted grade. So they weren't able to take their place because they didn't have maths. And it was such a shame. So we've offered them places this year on the condition, hopefully they'll try and get it this year. We also ask for IELTS unless they've studied at a higher level in English. Same as Fiona. I think it's probably, an NMC requirement, isn't it? It's level 7 or above.
Beverly, did you want to come in on that?
Oh, very much like my colleagues on the panel. That's what we would request for a student applying for a BSc Honours degree in adult nursing. But we also have the Foundation Degree Nursing Associate, which is a direct entry, and candidates may, as long as you have level 2 English and Math, functional skills, level 2 English and Math, and 48 Ucas points, we would look at your application.
Great. Okay. Yeah. Great. So there's a sort of a comment about it would be helpful in kind of entry requirements if sort of English language was specified kind of on the websites and stuff. I appreciate you guys might not be kind of in charge of that, but just as kind of feedback from the attendees, that may be helpful. Yeah,
it is listed there, and it is also listed on the Ucas. So once you go in to make an application, you can see all of that. So at LSBU, we will process applications from those people that are resitting their GCSEs and of course are technically still at school or further education, but for adults we do expect them to have that before their functional skills before we proceed. So we do make that clear, and that is practical because we have actually processed applications in the past, and when it comes to the end of the year, when perhaps we have closed the course, we find that those applicants to whom we had offered on the basis of functional skills do not actually get them in significant number for it to become problematic. So that's the reasoning behind it, and of course you can ordinarily, obviously pandemic has altered it all, but ordinarily you can actually go and get a functional skills within a 3-month period. So it is possible. We've looked very carefully at that, and it was not an easy decision to make. So if you're an adult without the GCSEs, then the functional skills really you need to obtain before you proceed. For midwifery as well, like Jane, I think it was Jane, we do require a science for midwifery applications as well.
Can I just say that if we have applicants who are studying their GCSEs, they won't get past the shortlisting stage for the same reasons that Fiona's talked about, because the GCSE results are so late in the year and we need our numbers tied up by then. So if by August the 24th or 25th they get the results and they haven't got their maths and English, then we can't accept them, and that's a place that we could have offered to somebody else. However, we will process offers who have functional skills pending because their submission dates are earlier.
Okay, that's really good to point out. Thank you. So kind of moving away a little bit from kind of entry requirements, and I think definitely that discussion really kind of emphasised what a lot of you were kind of talking about in your introductions, that applicants they really do need to look at the entry requirements closely before putting in the application, because otherwise, you know, what's the point? And hopefully the information is kind of all there to find. So it's really important that they do that. I mean, legally the entry requirements have to be there, so you know, so they are there. So kind of moving away a little bit and kind of talking more about kind of how the last year has gone in terms of recruitment. Obviously some of you kind of touched on it in your introductions, but kind of talking about sort of virtual interviews. And I know, Caroline, you kind of said you're not really sure for next academic year kind of what the process is, and I was wondering if perhaps the panelists could kind of comment on where you see interviews for health courses going, for instance, sort of, let's say next academic year. Do you anticipate they may be online, they may be in person? You know, kind of, could you give a little bit of indication on that? If I go to Caroline first, because I can see she's unmuted, so yeah. Actually, you've already kind of answered it in your intro, sorry.
We haven't reached that stage yet.
Yeah.
Because on the one hand, as the same as the teaching, really, there were benefits to some of the students who found it easier to access their interview in that way. But I think it's much more powerful experience for a student to come to the university, to get the feel of the university. We can incorporate other things into that, such as ID checks, looking at original documents rather than them holding things up to the camera. So maybe, you know, we may have keep the interviews online and then incorporate another event for the students. But also, obviously, we're just entirely led by the rules and regulations at that stage. Having online interviews has meant we can get through them much more quickly because we're not dependent on rooms and resources in the same way. And, you know, obviously, we can't sit in small rooms with students because of the health issues. So it'll be part of our review of the year to see, you know, how we move on with this and our brave new world next year.
Yeah, absolutely. Yeah. Any of the panelists, if you want to come in on that, if it's very much the same as Caroline, yeah. Beverly, go for it.
We'll be offering students to come online, come onto campus. In fact, we have returned to campus for many of our courses, especially nursing. We understand that we've realized the digital poverty and the way a lot of our students, in response to what they have said, they miss that learning community, they miss the engagement with the academic staff. So we are delivering online, on site, not just the skills, but part of the seminar delivery as well. So there is a varied experience that learners have. So with our recruitment, we will be holding fairs on site, as well as giving the student the opportunity to choose to do it online. So there will be a choice factor involved there. What can I say about students many of our students may have felt that just having the online experience has been somewhat difficult for many of them, with young children, etc., and the issues with online learning per se. So having heard that, those decisions have been made that we will be moving to a much more on-site presence.
Okay, fantastic. Thanks, Beverly. And Fiona, I see you've got your hand up, so feel free to come in on that.
Yeah, we've made a decision to continue online interviewing. We have observed a very similar pattern of offers and rejects to our live interviews. So we're quite happy to continue like this, and we realise that there are quite a lot of advantages to online. So they are 20-minute slots for the interviewee that they can select for themselves. We did have some hiccups with the platform, but we've dealt with all that, so that there are distinct advantages, and we can go into the evening interviewing, which of course has been an advantage to quite a number of applicants. And whilst I said earlier that we're mainly taking applications from people in London, when it is further afield, of course, it is a really big advantage to those people not having to spend a lot of money travelling in. So that's the plan at the moment for recruitment.
Fantastic. Okay, and Jane, I don't know if you want to come in on kind of, yeah, whether or not online interviews will carry on at Kingston and St George's.
Well, as the other guys said, to the best of my knowledge, St George's are going to move to face-to-face, and Kingston is probably going to do online. We're still clarifying it, but it looks like that's what we're going to do going forwards. But we'll put it very clearly on our website when it has to go to our senior management team, and it's not just the admissions tutors deciding. I just know, because we all talk to each other about what we're doing, that George's preference is to go face-to-face in September, all things allowing.
Cool. Okay, fantastic. Great. Thanks, Jane. And wondering, kind of, there was a question in the chat about emotional resilience needing to be evidenced in the interview. I don't know if some of you kind of seen that one in the chat. I don't know if anyone has any kind of good examples of how students have evidenced emotional resilience. Yeah, if anyone has an example that they would like to share, then please do. Yeah, I don't know, Fiona, perhaps obviously you were kind of talking about resilience quite a bit, so perhaps, yeah, some advice on how to evidence that.
It's very difficult to test, of course, and as I said, within the interview itself is something of a test. You know, that students become very nervous and anxious, and if they get through it, they've obviously got some degree of emotional resilience, and that they can cope with that. And for those that have an anxiety disorder that they may well put into their application form, they would still need to get through that interview. Clearly, if they couldn't manage an interview, when they got to practice, there'd be things that they would not manage there. You know, there are far greater demands from the job that you know, require that resilience. So nurses are regularly meeting sick and dying people, which does demand that resilience, that ability to cope, that ability to manage one's own emotions. Children's nursing students at London South Bank are the youngest students in the university. And clearly they've not lived long enough to have had experiences, personal experiences. Some people will talk about that. They will, so for example, one of our interview questions is at the moment, don't be telling everybody, please. It's along the lines of, your friend tells you that her grandfather is terminally ill. How might you respond? And of course, a good answer would be that you're going to listen to her and that you're going to appreciate that they will be distressed, maybe offer to do things for her, etc. And sometimes around that question, we will have an applicant that will disclose that this has happened to them. When they can hold their conversation, when they can carry on speaking, you know that they are, you know, emotionally resilient to a degree. But it is extremely difficult. And of course, many of these applicants, they get through the interview, they come to us, and then when they do arrive on the wards, particularly the wards, then they disintegrate. You know, it's tough. It really is tough. And then on the other hand, we have some amazing students who have had experiences that we would want. You know, they've had their own children die, and they They just manage absolutely amazingly when they do come to do the course. But I think for you, you know, with the students that you've got, and you know about them personally, these are conversations that I would like you to have with them. You know, what you know, and help that student explore whether or not they are ready at this moment to actually proceed. You know, maybe a little bit longer as they get over whatever their experience has been. They'll be more successful. Does that answer that question?
I think it does, Fiona. Yeah, and I can see Caroline's got her hand up. So if you want to come in on the question of emotional resilience, yeah.
I think the start of this is, again, them being able to articulate what it is that nurses do, because unless they can actually articulate that and show they have understood it and researched it, then they won't know what the resilience is that they will need. So when we ask them about, you know, the challenges of the programme, and they focus perhaps quite a lot on, you know, academic work or studying and placements, but then you have to dig deep and get them to think about, you know, conflict and the challenges of dealing with bereavement, with irate relatives, particularly again in child, where, you know, you've got complex family situations. Sometimes, you know, as you know, children's nursing isn't about the child, it's about managing the family and their grief or their distress. And I think that whole complexity thing is what often is missed. People think that, you know, they come along to the interview, they talk about, you know, holding hands and smiling, but actually it's so much more than that. So I think unless they can actually demonstrate that they understand what they're taking on, then exploring resilience with them is quite a difficult one. And actually, can I just give another hint, which is the NHS Careers website, which is really useful for students and staff talking about their expectations and their roles and their journey into the job they're doing. And I think that can be quite a useful resource for applicants as well.
Yeah, absolutely. Yeah, definitely. And I hope everyone knows that I'm very much a layperson when it comes to nursing and midwifery. So I have found the NHS Careers website really helpful in terms of kind of, yeah, outlining kind of what's required. So we've got a question, about communication needs of applicants and kind of reasonable adjustments. So I'm just reading the question. So sometimes students with ALS or communication needs, sorry, just going back up, worry that they don't come across as articulate enough in interviews as they may have barriers with communication despite demonstrated academic achievement. So would their level of articulation be kind of taken into consideration, for example? And I can see that Caroline's answer yes, as long as the applicants identify this to the panel beforehand. I don't know, kind of Jane or Beverly or Fiona, if perhaps you'd like to kind of sort of answer that question. Yeah, go for it, Jane.
I would say that there's not loads and loads of research around MMIs, but there's some quite good researchers that they don't disadvantage people with learning disabilities. In fact, they advantage them compared to the traditional format of interviewing. So we would not normally make adjustments. We would make physical adjustments for students that were unable, because there's like speed dating when you do it in real life, where there could be barriers if people have mobility issues, but we didn't make adjustments particularly for learning disabilities unless someone had a statement that they needed it to be read out, in which case someone could read it out. We did talk about this with our learning disability team about moving online, but we haven't actually made adjustments at the moment, but we took the time limit off. Whereas we used to have a time limit of 5 minutes, now students, in recognition of the fact it's harder online, can take as long as they need to answer the questions. Is that what I'm similar to you guys, I'm guessing? I don't know.
Fiona, I don't know if you want to comment on that.
Yes, of course, you know, things are covered by the Disability Act and reasonable adjustments need to be made. And whereas an applicant states that on the application form, then we will follow that up to determine that there is actually a space on the Ucas form to state what is needed from us sort of at that interview stage. So if, for example, someone was deaf and needed a signer, then there is an opportunity for the applicant to actually state that. However, and I haven't actually got the URL, I've been frantically trying to find it, there is some really good advice, guidance, should I say, from the Higher Education Occupational Physicians on what is really required. So for nursing students, there are limits, and once a student does have the reasonable adjustment made, then they will have to meet the criterion. You know, the students, when they are on the course, they have to meet practice standards, which are laid down by the Nursing Midwifery Council. So, and they need to be able to do that. So once you've got your hearing aid, for example, or your glasses, then you're expected to be able to reach that competency. I think it's very difficult, of course. You know, how would someone with an extreme problem, in fact, sometimes it's easier if it's an extreme problem, because it's quite clear that a reasonable adjustment becomes unreasonable and is not possible to accommodate when you think about the end. So the student needs to be independent by the end and be able to become an independent practitioner by the end of the course. And there's lots of debates going on around this. I mean, for me, I feel morally and ethically bound to enable a student to gain an education, a degree in something that takes them forward. So, and I have had experiences, you know, with a friend where she undertook a radiography degree and she's never practiced. She's registered blind, and I feel really quite aggrieved, you know, that she wasn't advised much earlier. And so I would appeal to you, you know, you're right at the beginning of these students' journeys. Try and get them onto the right course, you know, something that they're going to get a lot of job satisfaction out of ultimately. You know, there are limits. So, and I'm trying to follow the chat there, you know, where nurses need highly sophisticated communication skills, really good interpersonal skills. We have had students with Asperger's and autism on the course, and very sadly they failed, and they should have been caught much earlier and advised, and perhaps, you know, and now it's even more important. You know, it's costing a lot of money. Those experiences of mine were just a few years ago, and I feel really quite strongly about it, as you can probably tell. You know, we need to be giving these students the best, and getting them onto courses that they're really going to gain from. So it's, yeah, over to you to give them the right sort of advice there. And I'll try and get that URL from the occupational physicians, and I'll put it in the chat if I can. And if not, I'll follow it up, Jess.
Yeah, of course. Thank you, Fiona. Caroline, I don't know if your hand is still raised from before, if you wanted to kind of come in on kind of that discussion. But there is also a question about whether people are trending towards or away from MMIs. So I don't know if the panel would like to discuss that.
We've never considered MMIs. We've always stuck with traditional interviews, so I'm probably not the person to ask about that one. In terms of reasonable adjustments, I think sometimes, I mean, we did interview somebody who declared on their Ucas form that they were in a wheelchair, and really, realistically speaking, there is no way that you could negotiate a clinical area in a wheelchair. I think, you know, it's entirely different if you're a registered nurse and you then develop a disability, that you could then work in an area where you know, you could use your knowledge and skills. But there is a realistic aspect. You know, I've had conversations with applicants who are partially sighted, and reasonable adjustments wouldn't include somebody to draw up medicine for you. You know, you have to be able to work as an autonomous practitioner if you can't see numbers on syringes. So we're always happy to have those conversations. You know, if anyone has got applicants that they are concerned about, you know, we'll happily have that, because again, we shouldn't be taking people down a route where they're not going to succeed. And along with that, and I'm sure my colleagues have had this experience, is the issue around criminal convictions as well. That it's very difficult to make a sweeping statement about criminal convictions, but really anything custodial will always be a no. Anything very recent, multiple events recently. So again, you know, we would happily have that conversation before applicants go down the route of applying, because it can be that they're unemployable at the end of it.
Yeah, Fiona, you've got your hand raised. Do you want to comment on that?
Yeah. Yeah, I've had 2 applicants who were wheelchair users, and wheelchair users all of the time. So no mobility, you know, and they always had to use a wheelchair. And I've had also a blind applicant, and like Carolyn said, nurses have to be able to read an ampoule with small writing on, and nurses have to be able to stand up and stretch and squat and reach for oxygen and be able to give basic life support if necessary. So, and both of the applicants that were wheelchair users actually were on a health and social care course. So again, it was really quite frustrating that they weren't being advised. So this is my opportunity to really advise you to advise them, isn't it? And I still haven't found that URL, but I will do my best to do that. We do actually, having said that, we do have a learning disability nursing student, who is an occasional wheelchair user, and she's doing quite well. And of course we are watching her carefully and making sure that we look after her, of course, but also, you know, learning lessons from that. But she, you know, there's certain things that she is capable of doing, and she should be able to meet the competencies by the end of the course. But like Caroline said, it's very different once you're a nurse already and you've gone through it. Our disability advisor likened it to, you know, the course being like football. So when you're a professional footballer, you've actually got to be able to understand every single position on the football field. And that's what it's like on a nursing course. You need to be able to understand every position of nursing. Whereas, and obviously when you're a registered nurse, you've gone through that and you understand what it's all about, and you can take your place where you can still function, you know, in a wheelchair, if, for example.
Yeah, thanks, Fiona. And Jane as well, I see you kind of put a comment in the chat that you had a physiotherapist student, gosh, that's a mouthful, negotiate her course and qualify and was a wheelchair user. So that is really interesting to hear about, Jane. I don't know if you want to kind of speak about that any further, or about generally kind of the issue.
I'm just saying that we previously were very dubious about interviewing students with mobility issues. But I did see this girl go through her course, but she had been very fit beforehand and paralysed in a mountaineering accident and was highly motivated. But she did, and I would have again said it'd be very hard in clinical areas, but she did qualify. They did speak to the HSC, the Healthcare Professionals Council, and she's working as a physiotherapist. So I would say, you know, never say no. I suppose it's not. I mean, for our course, we try and take it on a case-by-case basis regarding. We haven't actually taken a student with mobility issues on our course, but we have interviewed a couple, but they failed the interview, I suppose.
Yeah, I think it is about a kind of a larger discussion about the right course choice, and I think that's very much what kind of the panel have kind of discussed as well. And I know Fiona, well, we were kind of speaking earlier in the week, is kind of, you know, oh well, you know, what about this? What about a different course with perhaps a slightly less kind of sort of the physical kind of grueling nature? I believe Fiona kind of said, oh well, we advise student maybe a nutrition course or something like that. So the kind of the different alternatives, and kind of Faith put in the chat that as careers advisors, you know, the attendees can advise, you know, concerning nursing, particularly if the applicants have a disability, but are also kind of reliant on the university side as well. It's about not a whole institution approach, but a whole everyone who's involved in the process kind of needs to get involved. And Beverly, I just saw you kind of pop your hand up if you wanted to come in.
Well, yeah. I did so very briefly, but it's just to reiterate that those are the measures that we use when we are looking at different applicants with different mobility issues or reasonable adjustments that need to be considered. But in view of that, we have different courses that our careers department would direct these students to, such as public health, different careers in health promotion, etc., where the requirements that is needed on completion of the program are not as stringent as one is expected to be that independent, autonomous nurse when you qualify.
Mm-hmm. Yeah, great. Thanks, guys. I saw there was a question kind of earlier in the chat about tips for online interviews. This is obviously quite a really, really important discussion we're kind of having about reasonable adjustments, but wondering if anyone could kind of talk a little bit about their experience of online interviews, and sort of to go back to the MMI question, if you could say whether you do or don't do MMIs, that would be really helpful as well. So if we maybe start, Beverly, with you. I know you were just speaking, but
that's fine.
Yeah.
We stuck to the traditional interview. We never went to an MMI, multiple interview process at all. And online, I think the advice would be attend the interview on time, because they're scheduled specifically during different time slots, and if you miss your slot, then you're not disadvantaging yourself of that. But also practice about how you would fashion your camera. What would you look? How you would evidence your identification. Have your documents ready, for one, and have some questions that you would like to explore with your interviewer as well about the course, because that's your opportunity to have a one-to-one engagement with somebody who is very directly and closely involved in the program. So those are my tips.
Thank you. Yeah, thank you, Beverly. Caroline, I want to go to you on kind of interview tips for online interviews.
Well, one of the things I'd like to suggest is that to the applicants is to read all the stuff that we've sent you. It might seem like a lot, but I think a lot of people do that spend their lives on their phones, and then they don't click on the links that are there, which has got links to articles, helpful hints on how to prepare, the type of things we're looking for. Again, it would be nice if you turned up. We had just to give you an idea, we had 2,738 interviews booked and 555 students DNA'd. We also had 310 who cancelled. Now, cancel's fine because you said I'm not coming, but if you DNA, you've got people sitting there waiting who could be doing something else, and also that's a slot that somebody else could have had. So one of the things we learnt very quickly is we had to build something in that if they DNA'd more than 3 times, that was it, they went, because we were having people who DNA'd 4 or 5 times. So by the time you get to it, it's pretty unimpressive, the fact that you've done that to the panel, especially when I've done most of the interviews, so I recognise names after a while as well. So you're not coming in under the best circumstances. I completely agree with Beverly. Think about what it is you're showing. I interviewed somebody on a Saturday morning who was wearing a dressing gown, and when I said to her, "You're wearing a dressing gown," she went, "Yeah, it's Saturday." And I said, "Well, do you not think this is a professional interview? You should be professionally dressed for it." No. Again, quite rightly think about the questions you'd like to ask, but some of the questions we've been asked is what's a typical day for a student nurse? And I think that absolutely shows that you haven't done your research, because my nursing colleagues will say there is absolutely no such thing as a typical day. So advise them to look at the website, look at some of the modules. Is there something they're particularly interested in a module? Perhaps I'd like to ask a question about that. Ask about I think as a rule, don't ask questions about things you could have read on the website. Like lots of times we get asked which trusts we're linked with. Again, that's on our website. So some people ask questions about us as nurses, which is fine, but it's about them gaining information about the university and what we're going to offer them.
Absolutely. Jane, did you want to come in on tips for online interviews?
I mean, I agree with Caroline, really. I mean, when we did face-to-face interviews, I used to tell all my interviewers, don't take any notice of what people wear. That's just, again, about privilege. And but, I think but you have to look like you care about the interview a bit. Fair enough, you might wear, you might not have smart clothes, but a dressing gown is just taking it a bit too far, really. It just looks, no matter what your cultural capital, it just looks like you don't care. If you haven't even bothered to get dressed, you just don't care about it, I also find questions that are on the website quite annoying, or questions that are very personal, like what's the worst thing that's ever happened to you as a midwife? Because for a start, you're interviewing 10 people in one session, in one day, and you haven't got enough time. And I think that they're the ones that should be doing the emotional, work, not us, in a way. and when you're interviewing lots of people, And also, if I would, which I would always do, is practice where your Wi-Fi's strongest. You know, practice that you can get on, that you've got that Teams downloaded, that your camera works, or whatever forum you're using. Just have a little run through it. Like, ask your students to do that. If we use Teams, do the rest of you use Teams or Zoom or something else?
Zoom. No, yeah, Zoom.
We use Teams.
Because if they log in on their college Teams, they've disabled the camera. So I think it would be helpful if colleges told students that, because then they have to come out and come back in as a guest, and that's 5 minutes of their interview time gone. I think not all, but it just seems to be, I've noticed that if they log on their college profile, they can't turn the cameras on. Some of them, quite a lot of them. And it's okay to do it in your car if that's the only place you can get peace, but just say something about it. Or we've had students sitting in the middle of the stairs where obviously their Wi-Fi was the strongest. But if they just say, oh, I'm sitting here, it doesn't, you know, and then it puts it in context for us. So, and it is
Yes.
Go on, sorry, that's
Oh
it.
no,
Really.
I was just going to say that was going to be kind of my question. Would you recommend kind of addressing those, you know, seemingly obvious things rather than kind of trying to ignore them, to say, yeah, oh, I'm in the stairwell, this is where my Wi-Fi is strongest, hope that's okay? Would you?
Well, I would, yeah. Otherwise, me and the interviewer spend the whole time wondering where they're sitting. Not the whole. Obviously, we're listening to them, and we try not to let it influence us. But I think, yeah, I think, like Caroline said, preparation, a little bit of reading. You're so right that the question our students answer the worst is what about the role of the midwife, which should be the one that's most straightforward for them. That's our like icebreaker before we do the MMIs, and it's the one a lot of people actually fail on.
Great, thank you, Jane. Fiona, have I asked you about tips for online interviews? I'm totally losing the plot. No, go for it.
I'd just support my colleagues here, and like Carolyn said, actually read what's sent to you. So the booking in system for we use Gecko for booking in, and we can actually see if applicants have opened their email or not. So I've had snotty emails telling me that the university haven't been in contact, and I can just screenshot and say, actually, we sent you all these and you didn't even open it, or you clicked on it. So you can actually see if they've clicked on it or not. We've got a very nice, well, I think it's very nice, the marketing department think it's very nice, a video presentation for applicants that are coming to interview with some advice on the interview. And the children's nursing applicants are the worst across all of our nursing applicants. They watch maximum 6 minutes of a 17-minute video. You know, it's really disappointing. And we're sort of thinking, well, you know, do we need to have a dynamic, zingy video or not? But, you know, what you want is somebody that pays attention to detail. And there's absolutely no doubt at all that those people that pay attention to detail, they've followed the instructions, they've got their Ucas number ready, they've got their passport ready so that we can identify them, they do better. You know, and so these are really important signs. And I think that for practice questions, we don't particularly like giving away our practice questions for practicing, because we're trying to put the applicant on the spot. We are giving them a story, you know, where they have to recognise that it is about advocacy or empathy or honesty. We don't want to give them any answers. We don't want them to have too much practice before. So I think that asking people that are interested in nursing, you know, why they want to be a nurse, what do they think their attributes are, getting them to identify their attributes. So why do you think you are a kind person? Why will you, you know, how can you advocate for somebody? How can you stand up for somebody? You know, honesty, that sort of thing. And they're really, really difficult to test, and yet we are required. So it doesn't matter what kind of an interview you give, one-to-one or a multiple mini interview, embedded within them, so that we are congruent with all the policy and advice, values. So, you know, this is what we're trying to test.
Also, towards the end of the cycle, we noticed people reading out the answers. I mean, obviously the interview questions go out there, but we can tell when someone's reading out answers, and actually they don't do themselves any favours, because we'd like them to be much more. It's a conversation. It's not a test. You know, we want them to talk to us about them And, you know, we will help and prompt where we can. But if you're reading out the answers because someone's given them to you, it's very obvious and it's not going to help you.
Yeah, we've seen them on the Student Room website, and there was some from our allied health professions team. So what we do now is rotate the questions, so the interviewer has a multiple choice to which question they ask. So we've got at the moment 4 questions with scenarios, and the number of the question relates to the values that are being tested and the story within that. Then they can choose their own story as to which one they will ask, because they were getting passed around, and yeah, it doesn't work, like Carolyn said.
Yeah, I think that is really good to know that, you know, it's not, like you say, it's not passing a test, it's proving competency, and you can't do that if you're just reading out the answers. Yeah, and I think as well something to kind of emphasize to students around sort of that it's, I think, you know, you've got to think of it as if you were applying for a job almost, like in terms of the, okay, so I've opened the email on my phone. Okay, now I'm going to mark it as unread so that I come back to it where I can sit down and take some time where I'm going to read the whole thing. I'm going to quit, you know, I'm going to make sure I click all the links, etc. It's not kind of, especially just because it's online. Sometimes I think mentally we think, oh, okay, this is less serious, but it's simply not. So it's about kind of, emphasizing that to students. I can see there's a few different kind of conversations going on in the chat, which is really great around kind of if someone's having Wi-Fi issues during their interview, kind of can they be rescheduled to get another chance? And like you kind of said, Caroline, you were sort of saying like, oh, if they didn't attend a slot, you know, we give them sort of it's 3 tries and then you're gone. And I think that's fairly kind of reasonable. So Fiona, go for it. You muted. One sec, Fiona, you're muted. Sorry, and I can't unmute you. That's weird. Yeah, sorry.
We only give 1 chance. So if they DNA, that's it, reject, because we've done our statistics. And like Caroline, we've provided hundreds of interviews and we have no return, basically. So they can object, you know, they can contact us, and that shows initiative, which is something else that we're trying to find. But yeah, you know, it's hundreds, and it's just a waste of everybody's time, really. And it doesn't show that commitment. It doesn't show attention to detail. So if you DNA, then we reject you.
Yeah, very reasonable, I think. Okay, so we're kind of sort of heading towards the end of our time, and I know that our panelists are incredibly busy, busy people. So I kind of want to take just a minute to basically just say thank you for your contributions and for answering the questions. I think it's really appreciated by all the attendees. So what I'll do is, because kind of the questions have kind of dried up in the chat, so I think we'll close it there. But yeah, just wanted to say thank you. We've got myself as Jess have a few things to kind of show attendees in terms of like resources. So I'm just going to very quickly share my screen to hopefully get those up and figure out all my different tabs. Great. So we have a leaflet that is available online, as well as a kind of a quick sort of helpful resource sheet that we've pulled together, popping sort of the key resources that we've created, as well as kind of others, and they kind of signpost to others. So those are going to be kind of shared with all of the attendees, and even if people kind of signed up and weren't able to come, those will be emailed out as well. Obviously, I'm having issues with kind of sharing my screen, so I'm only just showing you the leaflet as opposed to our resource itself, but it's just kind of sort of linking to all of the stuff that we've done. What I would like to do as well is encourage everyone to please complete our evaluation form. I know that like everyone asks at the end of an online event, and sometimes people don't have time to do it. It would be really helpful if you could complete our evaluation form. Hopefully my colleague Mel will pop the link in the chat, but it'll also be sent around afterwards as well. So just be great to get a little bit of feedback, as well as kind of pass on thanks to the panelists, of course. yeah, and I can see that kind of Natalie said that she's got lots of resources to share as well. So for instance, kind of some of the links that Fiona mentioned, etc., like those will be kind of included in our sort of post-event emails. Hopefully you've all kind of got them in one place. So yeah, just wanted to kind of say thank you again to the panelists and also to everyone for attending as well. So thanks very much, guys. Panelists, if you want to say goodbye and want to wave, go for it.
See you all.
Bye-bye now.
Thanks,
Yeah,
thanks everyone.
Thank you. Thank
Thanks,
you,
Jess.
Jess.
Cheers.
Thanks.
Thanks, Jess.